Several European countries are expressing concern over a new variant of the coronavirus that was first spotted in the UK, but has since spread to more than a dozen countries worldwide. That new strain now spotted in several Western European countries, but also as far away as Australia, Canada, and Japan. Japan even going so far as to ban all non-resident foreigners from entering the country through the end of January.
And joining us tonight to discuss this new strain is Dr. James Baker. He is a professor of internal medicine at the University of Michigan Medical School and a former chief of the university's Division of Allergy and Clinical Immunology. Dr. Baker, thank you very much for joining us tonight.
Thank you.
So let's first talk about the best way to proceed, right? Now that we know that this new strain, and there are two strains around the world, right, making their way around all these different countries on 4 continents, as close as Canada, many countries closing their borders. Is that the right thing to do, for example, here in the U.S.?
Well, it's a very interesting problem. Both England and South Africa found viruses that look a little bit alike, but came from totally different isolates. And part of that's because they lead the world in doing sequencing or identifying of the genome of these viruses. It's not clear that these viruses haven't been elsewhere already, and most other places don't do this sequencing. So until they do it, we won't really know the degree of spread. There also isn't any evidence that either of these viruses cause any more severe disease or escape the vaccines that have been approved, which is a very important point.
Yeah, that is important. I was going to ask about that. But when we talk about the spread, this new strain seems to be appearing in people under the age of 60, which obviously is a very significant public health challenge, since we know younger people often are asymptomatic and they're the ones who spread it often. So should we be changing the guidelines? Do you anticipate the guidelines from the CDC changing as a result?
Well, it's not clear that this is causing a different disease in young people. It may be that the transmission is more common, and it's in young people because the people who are spreading it are younger and are associating with younger people. So we really have to get an idea if there's a definitive change in the disease or the virus that would make us change our requirements, and that's not there yet.
So still a lot to learn about this, obviously. Public health officials warned that cases were going to increase in the U.S. after Thanksgiving. That was indeed the case. They issued similar warnings about Christmas, anticipating family gatherings and travel. What are you expecting in the next couple of weeks with the virus?
Well, unfortunately, I think the number of cases is going to bump up again. Clearly there was a great deal of travel. I think there are people who are out there traveling when they have some symptoms. Obviously, that story of the gentleman on the airplane who had a heart attack who knew he was infected suggests that there are folks out there who are traveling when they're infected. So I think we're going to see an increase. The amount of that increase, though, really is crucial because that will determine whether or not hospitals get overwhelmed.
That has been a huge factor, and we are out of time. Thank you very much, Dr. Baker, for joining us tonight.
Thank you.